Yeah,
And
that's
you
fair.
just to interject here, Nick, a little bit. I feel
Mhm.
Dr. Fazio, we just did your wife, right? Dr. Newsom did your wife's surgery, and we put the eye adjustable lens in her, right, Faz?
Who, Tina?
Yeah,
Is she married to me? This is weird.
last
So
I
my
checked.
wife, yeah, so my wife had her second LAL done today.
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 Okay.
Today.
So good
So
question then.
so there's
Follow up.
there's a
Go
lot of I didn't tell you, Nick. So
ahead.
let's see how this
I just,
comes in here.
yeah,
Uh,
I'll tell him. Don't worry.
so Tina's right here. So Tina hears her name and she's
There
popping her
she is.
head in.
Hey.
You can see her
Hi,
little
Tina.
her little glasses. My wife Tina. So a little
How you
bit, because I
seeing?
know Nick, this is kind of cool to kind of do this. And when you do it
Yep.
on your own family members, obviously my lovely wife here, you trust technology, number one. Funny
Yep.
enough, she's in the OR. Her sister-in-law is next to her, who's at RK getting an LEL. And then the head nurse's husband was there as well, who's a pilot.
Wow.
That tells
Okay.
you a little bit about why you recommended. And she's had LASIK. She's had hyperopic LASIK, Tina has. So you can see she's wearing the glasses, being a good girl.
Looking good. I love it. Looking
There's
good.
some questions, we talk about, but like, did you drive today?
I drove today, yes.
And she picked up my kid today. So we obviously, that we could talk about that and we can talk about a
Sure.
bunch of different things and talk about how she's wearing the glasses and what's going on. I'm not going to hold her here to do that. Thank
Just
you.
wear a jersey. Just wear a
Yeah.
jersey.
Yeah, you gotta wear
We're
you need
done.
your
We're done.
jersey.
Thank you for popping in.
Yeah.
Congratulations. Hard part's behind you.
Yeah.
She's loving it already. So,
And big question, Eric, are you doing the adjustments?
yeah, of course. Definitely.
All right. All right.
100%.
So you guys hit on a good point already. I mean, the effective lens position. So the stat you said, the number you said, 1 millimeter. The rough math works out 1 millimeter equals 7% of the power of the lens, which ultimately, if you have a higher powered lens, if you're more farsighted, that means more of a refractive error. So that's why, especially people who have sometimes higher prescriptions can end up more off the mark because the lens can be shifted. There's more room
Yes.
for it to move. Now, your wife, she had hyperopic LASIK. That's a completely different wrinkle in this whole equation. It makes our numbers and our math just really less accurate, right?
Oh yeah, yeah. I should have brought Tina's corneas here, but the maps. It's not just, yeah, for her. She's got that almost that conus look with an oblique astigmatism. But fortunately, even in the early refractions, guys, that was the first eye we did was her worst eye. She's going to hit 20/20. She should be fine. Again, to Brian's point, we use this lens like crazy. So, we're doing 1,000 a year past 5 years. We've done a gazillion hyperopic LASIK patients and myopic RKs, just more than I can count. So I've got a good feel on how do you work with these and what's your success rate, and insanely confident about what the lens can do. And also, how do you talk to the patient about expectations and what do you do? I feel very comfortable in my skin doing that. And I think that's important, as a provider and for a patient hearing that, they want to hear that kind of confidence and what are the expected results. And can you talk to that with experience, I think is key.
The most common question I get, probably the most common question, is about those awesome glasses that your wife was wearing. You talk about how you have your patients wear those glasses, when they have to wear them, when they don't have to wear them. We know what the label says. It says 24/7, but
Yeah, sure. It does. It does. So that's funny. I made her come in here with those on because I wasn't sure how, I wanted to take that. But it's dark here, so she's immediately got them off. So if that's a good question. If it's dark out, uh, she's not wearing those glasses. That's just
yeah.
not happening. Showering, all this. So I have a window over there. She's not wearing those glasses. If she's inside and we have a fairly good blind system and the blinds are drawn, she's not wearing those glasses. She's taking a break. She's maybe wearing cheaters before the first adjustment because that's, a little bit hyperopic where we initially target. If we can get lucky enough to hit there. She has hit there, so she can just wear some cheaters for reading temporarily. Distance is already pretty good. She's driving without glasses. Uh, Now, for going outside, walking the dog, doing things like that, she is wearing her glasses. She's wearing the Arc Sight. Bit of a misconception there is the UV protection is equal between any pair of the glasses. You do not need to necessarily wear the dark pair going out. If you accidentally walk outside with the clear pair, you're fine. I'm sure you've heard that, Nick.
Mm-hmm.
They're like, oh, I didn't wear my dark glasses. The UV protection is 100% the same. It's clear. It is not tinted. The tint is for comfort only.
Right.
But that's kind of where we're at. And, if you're at a station, you're in your office, we have a lot of very active people that get surgery and try to get back to work, get back to their computers, whether they're working at, on site or they're at home. They're just more comfortable sometimes in cheaters and stuff like that. And, we encourage them to do that as long as they're just making some protections against UV exposure.
Yeah. Anything to add, Brian?
No, I mean, the other thing, Fazio hit the nail on the head. The other thing, too, it's a great marketing strategy for RX site and our practice. You know what I mean? So these glasses, they're conversation starters. People, they wear them to dinner, they wear them out on their walks, they run into other people. Like, what are those glasses? What is that RX site logo on the side? And it gets you talking. It gets the patients talking, like, oh my God, there's a lens that can be adjusted. Like, that's amazing. It just builds up that kind of momentum or that kind of conversation about the lens, which is really cool, in my opinion. That's probably the only thing I would add to the glasses discussion. Fazio hit the nail on the head.
The funny story, I've told this story before, but I had two patients who I did adjustments on at different times. I had a guy going through it, and he's like, I met a woman, and she saw my glasses, and we started a conversation because we both had that in common. And I was like blown away. So I was playing matchmaker, really. And I'm like, you guys have this most super unique thing in common, and I am like at the center of it. I feel so honored. And so if you get married, if things work out, I appreciate that wedding, right? Yeah. I think it lasted one date, maybe. I asked him about it. He's like, oh, shoot.
They were too particular. I'm sure both patients were very particular.
They might have been pretty. They were.
like things a certain way.
Yeah. But the glasses, that's a big thing that we hear about, do I have to really wear these glasses all the time? No, you don't. You really don't. The FDA label was written for the previous version of the lens that didn't have something called active shield. So active shield is like a redundant coating on the lens that protects it from environmental light. So in normal room conditions, you're getting enough coverage. Now, what we don't know, or at least I don't know exactly, is how long an active shield lasts. The other question I get sometimes is, well, if we get to a good spot, do we even have to go through the lock-in process? You do, because active shield at some point does wear off. Now, how long is that? I don't really know, and I'm sure somebody does. I don't know. I'm not a polymer scientist. Generally, though, we want to be done with the adjustments in about 6 months. That's just kind of our guidelines. But if you walk to the mailbox, you forget your glasses, did you really ruin everything? No. It's just a cumulative amount of UV light that you're exposing yourself to. We'd prefer you don't, but, did you really mess something up? No. Now, don't get on a sailboat in the Caribbean for 3 months and not have your glasses on. That's a different story. That probably will do something, but we
have seen that. Yep.
We've seen that.
How'd it go?
Yeah, not good.
Not good.
The lenses. Yeah.
Okay. Yeah.
That was before active shield. Yeah.
Okay.
But, yes.
Yeah. So the lens can be warped. And, there's only one thing to do at that point. Let's take the lenses out. Now, Brian, how do these lenses, have you taken one out before ever?
So they definitely, once you have them locked in, they're a lot easier to take out, like before you do an adjustment. Or, then that happened one time where we had kind of a miscalculation and the patient actually had their contact lenses on during our topographies, and we didn't realize, and we actually were off a couple diopters on the lens. So, very easy to explant a silicone lens before you start doing adjustments, especially before you lock in. But it seems as though every time you do an adjustment or a lock-in, that lens gets harder and harder and harder. And the problem is when you go to take it after a lock-in, sometimes that lens can shred like glass a little bit, or it can break like glass. And you really got to be careful to get all the pieces of that lens out. So you're hoping, when you put this lens in, you don't have to take it out. Very few times are we explanting these lenses, but it does happen. But it can't be taken out. No problem.
Yeah, we've taken out very few, and they're very strange circumstances that we've taken them out for. I can tell you that for a fact, we've taken out way more other types of lenses than we have the LAL. I can count on one hand how many LALs we've taken out of the thousands that we've done. Yeah. They are difficult to come out. And again, we don't ever intend to take them out. So when we make this decision, we're kind of trying to future-proof your eyes. We're trying to get you to a spot where you won't need cataract surgery again. Now, we can't guarantee that something else won't happen, right? We can't guarantee that you won't get macular degeneration. We can't guarantee that your eyes won't, change over time in an unpredictable way. There's always things that can happen. But, the one thing, again, people tend to try to look for a guarantee, and I can't guarantee anything, but I do expect things to stay very stable over time. There are two things that dictate what your glasses prescription is going to be. Number one, it's your lens, which is now synthetic and it's in a fixed position. And then number two, it's your cornea. Your cornea changes until about age 30 in relation to the length of your eye, but that pretty much stabilizes. So once you get to that certain point, there really shouldn't be any refractive shifts unless you develop some sort of change in your cornea, which would be unpredictable. But again, controlling the variables is really what we're trying to do. I tell people too, same thing with the glasses that you mentioned, Fazio, is the UV light, the clear ones and the tinted ones really do the same thing. There's really not much of a difference between the two. It's more for comfort than anything.